is there a way for patients to treat or out their cardiac toxicity when going through chemotherapy?
Well, I think the most important thing in terms of if you're receiving any of the medications I mentioned already, adriamycin, Herceptin, or Perjeta, and if you have heart disease to start with, or you're receiving a very intense treatment that requires high doses of any of these three, then you probably should make it a point that maybe you should be seen by a cardiac specialist. Now, probably from the patient point of view, you have to monitor your own symptoms. Of course, in the course of chemotherapy, it'll be normal for the patient to feel tired, to feel kind of wiped out sometimes by the treatment. But there's a difference between being tired and being out of breath. If you feel out of breath, that now with minimal activity, you have to really catch your breath, just going from your car, from your house to the car, or vice versa, or just minimal activity really gets you out of breath, you should see your doctor immediately, because that may be the first sign that you're developing toxicity to the heart. Now, these patients also, fundamental in their treatment is their follow-up. As I mentioned, these patients require serial ultrasounds of the heart to make sure that the cardiac function remains normal throughout the course of treatment. Now, there are, besides actually looking at the pumping of the heart, and we have images there of an echocardiogram being performed.
I mean, do these heart ultrasounds, do they help in treating the heart disease?
Well, they help in diagnosing. These are exclusively for diagnosis. And we have two ways we can look at the heart. As you can see, it provides images of the heart pumping, and we can then estimate what this number is very important, the ejection fraction of the heart, how much of the heart is pumped out of in every heartbeat. And we want it to remain normal.
Right.
For at least in terms of cancer treatments, you want that number to be over 55%. Let me clarify that nobody pumps 100%. Normal is anywhere from 55 to 70%. That's the normal pumping of the heart. So you want that number to be over 55%. And if we detect that that number falls, and even if the patient has no symptoms, then we need to treat.